SoundLIFE is a one-stop hearing healthcare center that focuses on diagnostic and management of hearing disorder. We offer a complete range of hearing products and solutions for both our adult and children. We strive to provide professional and personalized hearing services by our trained audiologists. In SoundLIFE, we are all certified audiologists, where we follow the best audiological practice in order to help our clients to rehabilitate their hearing-related difficulties. We carry different brands of hearing aids and few other health products to fulfill the requirement and need of our clients.
It's amazing to see how much joy one can achieve through better hearing.
My life is much better now with my new pair of hearing aids. I can FaceTime call to my children.
My hearing impairment improved tremendously, and I'm very satisfied with that.
Here at SoundLIFE Hearing, we are focused not only helping you to hear better, we help you through all the aspects of your hearing health. If you have any questions about your hearing, contact us and schedule an appointment today.
Good evening, everyone. Welcome to our Facebook Live. Today is My Child Autistic. We are very honored. Let me introduce myself. My name is Aliyah Sheng. I'm Chief Audiologist and founder of SoundLIFE Hearing. Today, let's welcome Dr. Annie to our Facebook Live. Hi, Dr. Annie.
Hi, Aliyah.
Hi. Dr. Annie is actually consultant pediatrician, special interest in autism diagnostic, right, doctor?
Yes.
Yes. Okay. So over here we have a few audience. Hello, hi, welcome to our Facebook Live. So if let's say you have any questions, feel free to ask us also. So doctor, can you briefly tell us what is autism?
Okay, thank you, Aliyah, for your questions. Autism is what we call a neurodevelopmental condition. Neuro means something to do with the brain. So basically, children with autism, they are born with this brain system, which is like wired differently compared to normal developing children. And when I say developmental condition, is basically this condition, it has an impact on the children's developmental trajectory. So they are going to have a developmental milestones progression, which is atypical compared to their same age peers. And this condition is predominantly has a genetic basis. However, this genetic basis is quite complex. It's very unlike conditions like Down syndrome, whereby the chromosome abnormality is very straightforward. You actually can do a blood test to test for this. For Down syndrome, there's an extra copy of chromosome 21. Whereas for autism, things get a bit more complicated than that. Scientists have do a lot of research. Actually, they identify more than 500 genes which has been implicated in the causation of autism. However, genetic is not the only thing that causes autism, and scientists believe it's an interplay between the gene as well as something in the environmental factors as well. So it's quite complicated. And the other thing that makes this even more complex is the spectrum of people with autism is actually very wide. That's why we call it autism spectrum disorder. There's a saying that if you see one person with autism, you see one person with autism, because they can be very different. It can be a person at one end of the spectrum. We are looking at, it could be an adult with autism who has intellectual disability, who is not able to take care of himself and very dependent on others to take care of his daily living.
Okay, so doctor, I think let's pause a bit because as a healthcare professional, I also feel a bit lost already. So I'm not sure about our audience. Okay, so can you, doctor, explain maybe in a short way? So just now I heard you say that autism spectrum disorder is a developmental disability caused by differences in the brain, right? Okay,
Yeah.
so how does this actually you also mentioned about something about the gene and also the environmental factor may cause it lah. So is there a genetic test that we can be doing in order to find out what is autism?
Okay, so in research, actually scientists have done tests trying to identify what genes are responsible. However, they have identified more than, it's about 500 to 1,000 genes. It is not just one gene. If you have like one or two genes, then we probably can do a blood test to test for it.
Yeah.
But when we are looking at so many genes, so it's actually not feasible to do the test. And also, a lot of these individuals, when we do the test, they probably carry one or two genes that has been implicated. And another thing they found out is that even though the individual has this gene, it's not necessary that they will develop autism later on. So
Okay.
it's complicated. Yeah.
Okay,
So
so I think
yeah.
okay, maybe we proceed to understand what are the signs and symptoms of autism first lah. So I saw doctor you got prepared some slide, right?
Yeah, just now I was talking about this very wide spectrum. So it could be someone who is very disabled, like which I mentioned, and it can also be somebody who is probably smarter than you and I, and just having some difficulty with social communication problem. So basically, the main problem in people with autism is social communication challenges. They have problem in navigating the social communication part of our world. And so there are two problems in autism. One is social communication, and number two is what we call restricted repetitive behavior, which I'm going to elaborate. So actually for early signs of autism in young children, actually I come up with these mnemonics to make it easier to remember. I call it the 9-knot spiral mnemonic. So there are two S's. The first S stands for not speaking. So this is one of the very common complaints that bring the parents will bring the child to see a pediatrician. Is most of the time it's because the child is not talking or the child has delayed speech. So this is very common among children with autism. And then the second S is not smiling. Okay, so a normal baby, actually by 6 weeks of age, about 4 to 6 weeks of age, they will develop what we call a responsive smile. When we smile at them, they smile back at us. So if by 6 weeks old, where you notice that your baby is actually not smiling back at you, this is something of concern. Okay, and the next one is there are two P's here, the not pointing. Again, this is a very, very common symptoms we observe in children with autism. They are not using the index finger to point to things that they are interested in or pointing to request for things. Usually by 14 months, latest by 14 months, most children would be using their fingers to point to ask for things or to show something that they are interested at. Actually, some children even do this earlier on, like around 9 to 10 months of age. So another P is not progressing. What I mean by not progressing is what we call regression. Okay, regression means these children, they have actually acquired certain skills, maybe like smiling, very good eye contact, and maybe have some meaningful speech. However, suddenly, these children suddenly lost of these skills which they have acquired before. So this is what we call regression. So in children of any age, when we see there is regression, this is very alarming. This could be a feature of autism, of course, but it also can be a feature of other condition, neurological condition and metabolic condition as well, that we need to further investigate. So the next one is I. I is not imitating. Okay, by 18 months of age, most children will start imitate what we do. They will imitate us. Maybe, for example, they see us sweeping the floor, they will try to take something which looks like a broom and try to sweep the floor. They imitate us wiping the table. They probably see daddy fixing some stuff. They also trying to bring something that look like a hammer and try to fix some stuff. So if your children is not imitating by 18 months of age, this is a red flag as well. The next one is R. R is not responding. Again, very common. The parents will report that, or sometimes in my clinic, I will try to call the child's name, maybe like, for example, Jaden, I probably calling 10 times, 20 times, and the child is not responding. Even the parents call their names, they're also not responding. And a lot of times the parents will tell me, I actually really suspect my child is deaf. Okay, so this is one of the very common symptoms of autism. You call their names, they are not responding. And the next one is A. There are two A's here. Not appropriate and not afraid of strangers. Again, a lot of times we think autism means they are in their own world, but there's another extreme is they have no stranger anxiety. So I have kids who first time seeing me in the clinic, they will come near me and sit on my lap and very, very overly friendly with me. Even though this is the first time we meet and I'm supposed to be a stranger to the kids. So this is again quite commonly reported by parents as well. Usually children around 9 months of age, they will have this developed stranger anxiety, which is a normal developmental milestones. And they know how to differentiate between familiar people versus a stranger. So if your child does not show any stranger anxiety by 9 months of age or 12 months of age, I think this is also something of concern. And lastly is not appropriate. Not appropriate means this will be the behavior domain of autism. A lot of these kids, sometimes they have this very unusual repetitive kind of behavior, like they like to line up objects and they get upset when the lining is being disrupted. Sometimes they have repetitive kind of body movements like hand flapping, self-spinning. Some of them like to pace in circles. Some of them like to play with fingers in front of their eyes. It can be in the usage of speech, repetitive speech, what we call echolalia. Sometimes when we speak to them, they speak like a parrot. They just repeat the same thing that has been said to them. This is called echolalia. Or they can be speaking what we call jargons, which is some made up words on their own and is incomprehensible to us. And sometimes they also have very unusual hyperreactivity or hyporeactivity to sensory stimuli around them. So the sensors, which includes to certain lights, to certain sounds, to touch, to taste, to smell. These are the sensory differences of children with autism. And sometimes they also have very intense what I call passion or enthusiasm, very intense and narrow enthusiasm in a subject or an object. I have kids who like marine animals. He's around 4 or 5 year old, very minimal, meaningful speech, and yet he can actually recite all the scientific names of the marine animals. So they have very narrow kind of intense interest. So lastly, the L stands for not looking. So again, very common, very poor absence or poor eye contact. So these children, they avoid eye contact. So actually, now that we have adults with autism who actually can tell us why is it, now we know that for people with autism, for them to look at us and while trying to figure out and understand what we are being said to them, they find it actually very overwhelming. So this is, now that we are gaining more and more understanding, why is it autistic individuals, they can't look at us when we talk to them. They are actually listening and paying attention, just that they are not looking. Yeah, so this is my summary of the early signs of autism in children, which can apply to older children as well.
I see, Doctor. Very comprehensive summary. So by now we suddenly have one audience over here, Shanice. Shanice is asking, possible before 1 year old have eye contact respond well, but after 2 years old slowly drop like no eye contact and don't talk. Is that possible happen?
Yeah, this is what I meant. This is what we call regression. So regression has been observed in a proportion of children with autism, meaning when we ask the history, they were developing quite okay. Then suddenly they lost all these skills like eye contact, or sometimes it's the speech, sometimes it's the social interaction. So it's like they're regressing, like they're going backwards. So we actually do see this not in all children with autism, but in some children with autism, they have this regression. And depend how serious is the regression. Sometimes we also may have to consider some other investigation like brain imaging, EEG, which is to measure the electrical activities in the brain, and metabolic workup. But this is something that has been observed in some children with autism. Yeah, it is possible, but it doesn't happen in all children with autism.
I see. Okay. So, doctor, my next question to you, it would be, how is actually autistic kid different from normal child in terms of their hearing sensitivity?
Yeah, that's a very good question. Not all, but quite a significant proportion of autistic children have what we call sensory processing disorder. Actually, sensory problem. So what do we mean by that? Meaning, I mentioned about the 7 senses just now. Yeah, which is the sight, hearing, smell, taste, touch. There's another one which is vestibular for balance, and position sense, which is proprioception. Actually, there's some authority proposes a sense called the interoception, which is a very sensation of internal body sensation like hunger, heartbeat, and so forth. So what happens with some of the autistic children is that either they can have hyper responsiveness, or the other way around, which is under responsiveness. So when using hearing as an example, very common, a lot of these children, they have hyper responsiveness to certain sounds. This can be quite variable, but the common one is loud sounds like firecrackers, fireworks, loud music, crowded places. So sometimes these kids, because they are not verbal, what we see is a meltdown. Suddenly they roll on the floor, they are screaming because they can't talk, they are not able to express themselves. And a lot of times it's due to this hyper responsiveness to certain sounds. However, it can be the other way around, which is under responsiveness, again, which we observe, which is they look as if they are deaf. We call their name multiple times, no response. However, we send for hearing assessment, maybe to your side, then you come back, the report says hearing is normal. So the hearing, the apparatus is normal, they can hear. However, they are just not responding to when people call their names. And what is even more interesting is that these kids can have both at the same time, meaning they are not responsive when people call their name, as if they are deaf. However, they can be super sensitive to certain sounds. So they can have both. They can have both. Yeah, so this is, there are actually some studies done on this, looking at auditory hearing sensitivity in children with autism. And I actually the impact on the family is actually very significant, and we really need to find a way to help them, because a significant proportion of these kids, because of this problem, it prevent the family from a lot of family activities,
going out,
it's just stress. I have families who tell me, Dr. Annie, I have not been going balik kampung for Chinese New Year or Hari Raya because my kids will have meltdowns with all these noises and firecrackers, and we also don't invite family to come over. I mean, it's very disheartening to hear this, but this is the reality for a lot of this family. And the research has also shown that sound sensitivity also causes very significant distress and stresses for the kids as well as the family members. And one particular thing that concerned me the most is one study actually quoted 42% of these children, because of sound sensitivity, they actually will run away. Okay.
Yeah,
We know
I
that.
also, yeah, I would say sometimes because doctor, you also refer some cases, SoundLIFE alarm, which we are also specialized in pediatric hearing assessment. Then there are some patient when they come to our place, actually they are quite quiet. However, sometimes when we play certain sound, it could really like hypen them up, and then even like during the case history, the parents tend to say that wow, my child will scream and run away, all these things, or even with some impulsive behavior like hitting or hyperactive. Then it's very hard for us to conduct the test as well. Yeah. Then
Yeah,
even like
actually,
a lot of online also videos we can see. Over here, doctor, I think I remember you share a video, right, to us. Why not we just show to the audience so that they can understand more? Okay,
yeah. I
so
think we
yeah,
show the
Dr.
video.
Yeah, we will show a video now. Okay, this video is actually called "Can you make it to the end?" Okay, so over here we will show this video. Can you make it to the end? And then the video is a bit long. It's about 1 minute 30 seconds, but this is actually taken by UK, and then they are actually taken this video from the the POV point of view from the autistic child. Every stimulus that we sense in our daily life, right, may sound insignificant to us, but to them it's very different. So let's take this 1 minute to actually understand more about our autism kids. Okay.
Two, three, four, five, 6, 7, 8, 9. Take my hand. No, Alex. It's fine, isn't it? I'm not naughty. I'm autistic. And I just get too much information.
Well, okay. So we can see that a lot of the daily life, even like the water splash, is just a very normal sound to us, but it's very different from for them, right? Doctor?
Yes, like even to smell. So I don't wear perfume when I go to work because bearing in mind these kids might be sensitive to perfumes or certain smells. Yeah.
Okay, so doctor, just wonder because just now you mentioned about 7 cents, man. So these are the seven,
Yeah,
right?
1, 2, 3,
Yeah.
4, 5, 6. Yep. But some
Yep.
authority they are proposing there's a 8 cents we call interoception, which
Okay,
is the sensation. Yeah, but I don't think we have time to talk about that here.
Okay,
But
so
this is the main one. Yeah.
this is the main one. So are those like autism, those like autistic kids, they only the hearing is being affected or everything's?
No, it can be any of these senses, or even can be all, can be a few, can be just one. But again, not all autistic kids will have sensory problem.
Mm-hmm.
Yes, some,
Okay.
but majority will have. Yeah.
Okay, all right. So, okay, let's move to the next questions, which I think a lot of people is interested to know. Okay, doctor, what kind of assessment are to be done for you to diagnose the child having autism? And many people may also ask, is all the pediatrician also can diagnose?
Okay. Actually, as a general pediatrician, we do have training in learning about autism, recognizing the signs and symptoms. So I would say most general pediatrician has a training to pick up children that is suspected to have autism. The challenge comes when there are cases that is maybe a bit on the borderline side, whereby these kind of cases, they will need more expert clinician, which is the developmental pediatrician. You know, the reality is in our country, we have very few developmental pediatrician, and the waiting time is super long.
Yeah.
And however, for autism, okay, when we diagnose autism, we will say there are 3 levels: level 1, 2, 3. Level 1 means needs support, level 2 is needs substantial support, and level 3 means needs very substantial support. So I think for level 2 and 3, most general pediatricians should be able to at least suspect these kids might have autism. So the tricky one may be the level 1 ones that might need more expertise, like developmental pediatrician. So so this picture just show my very basic clinic setting. Actually, the mainstay of assessment for autism is essentially is a clinical diagnosis, right? It's a clinical diagnosis. The mainstay is actually, there's no shortcut, very detailed, careful history taking and direct observation. And sometimes we use some standardized instruments to help us to gather some other information to help us in the diagnosis, right? The mainstay is still the careful history taking and direct observation. So in history taking, sometimes parents ask me, Dr. Annie, you really ask so many questions. I say, I have to. There's no shortcut. I have to ask from pregnancy. How's the mother health during pregnancy? Does he have any problem? Because I'm also trying to find out, is there any risk factors? We have identified some risk factors that may make the child to have higher risk to develop autism. Again, please understand, risk does not equal to cause. Risk just means increased risk. So for example, if the mother has certain health condition like maternal obesity, maternal diabetes, maternal infection during pregnancy has been implicated in studies that may increase the risk of autism. The another one is mothers with epilepsy that is on certain type of anti-seizure medication be implicated as well. There are 2 particular types, the valproate and the topiramate, has been implicated that may increase the risk. And for the baby, if say the baby is born very premature, especially less than 33 weeks gestation, or very low birth weight, less than 1.5 kilo, this also has been implicated as a risk factor. Another one is the advanced parental age, which has been implicated as well. So these are the risk factors. So I will ask this in the history. So the pregnancy, how is the delivery, how is the birth? Is there any complication during the birth and delivery? Whether or not the baby the mother has to go to emergency operation because there are signs of baby not getting enough oxygen. Is there any complication that might cause delivery of less oxygen to the baby's brain? If that happens, also that is a risk factor that will increase the risk of autism. So this I have to ask during history, and I have to ask about social history. Who takes care of the baby when the baby is born? How is the house environment? Who takes care? What is the language spoken at home? And then does the baby get any ear infections, recurrent ear infections, which may affect hearing, things like that? And is there any history of seizure problem? Because some kids with autism might have coexisting seizure. And very important, family history. For the mother side, the father side, is there any relative, family members who has speech delay, who has autism, sometimes not diagnosed, but it's like they will tell me this like got some autistic features, but never get diagnosed, but they have just some of these traits or speech delay or any other developmental delays. These are all the things that we have to elicit from the history taking. Then of course we also need to do a physical examination. We have to look at the child's growth, because the head size, the height and the weight, because sometimes there are some syndromic chromosomal genetic condition that is associated with autism, like Fragile X or tuberous sclerosis, and they have some specific features that we can see and can confirm by doing a genetic analysis test. Then sometimes a lot of these children are very, very picky eater. They very limited selection of food, and they are very at a high risk of malnutrition and also stunted growth. So we also need to look at their growth chart. And after this history and physical examination, then again do developmental assessment using some standardized instruments to see, like, this child is probably currently 4 years old, but in all the developmental domain like gross motor, fine motor, speech and language, social and self-help, he is at what level, maybe he's now 5 years old, but his speech is at 2 years old, his gross motor is at 4 years, something like that. So developmental assessment. And during usually I will let, when I talk to parents, I have a nurse assisting me. The nurse will be sort of playing with the kid. When I talk to parents, I'm also observing the kid at the same time, how the kid
You have to multitask, doctor.
have to you see, it's a very basic toy setup, as you can see here, but it can tell me a lot of things. How the child play with the toy. Yeah, is there any play? Is there any imaginative play? Does the child play with the toy appropriately, or does the child pretend feeding that puppet monkey there or the puppet lion there? Or but sometimes a lot of things I can see a lot of these kids, they are not interested at all with all these toys. Yeah, they probably interested in just the puzzle, or just lining things up, lining the one kid just lining the color pencil up on the table. No interest at all in the other toys. Actually, quite a few of them, they were interested in that metal piece of the door stopper in my clinic room. They were playing with that, and they were not interested in all these toys. So
they have very specific, like, preference towards toys. Unlike, like, maybe some of the children, they look, as long as they look at a new toy, then it will interest them straight away. Is that what you mean, doctor?
Yes, you're right.
How long would be your overall assessment actually for, the one that for the children to be diagnosed, and then for you to go through all the assessment, just now what you mentioned, like the speech, the hearing, the fine motor, gross motor, and also the detailed case history and all this? How long?
I wish I have a shortcut, but I don't. Depends. A lot of time I may not be able to settle all in one session. Even though before family come to see me, I actually send them quite a lengthy questionnaire to get some information beforehand. But still, it may take more than one visit, sometimes two, sometimes even more than two visits. It depending on the.
How long is one visit that you slot in? Your
I think every doctors have their own way of doing things. For me, it's 1.5 hours per slot. Yeah,
1.5 hours per slot, and sometimes you say it take more than 2 hours, 2 slot. So meaning 3 hours plus lah.
No, I don't. I try not to exceed, because all my family has a designated slot. It's not fair for if I go overtime for this family, it eats into the time of the next. I think it's not fair. Even though sometimes I can't help it, I do go overtime a little bit, but I try not to. So it depends on the case. Some cases actually will need more than one, sometimes even a few assessments to complete the picture. So because every kids are different, so it's a very, as you can see, it's a very lengthy process.
Yeah.
Because we don't have we don't have blood tests. It's not like diabetes. I just do your blood test, I can diagnose we have diabetes and things like that. I can't do a brain imaging and say, okay, this is autism. It's not like that. So it's by observation of the behavior and also getting the developmental history from birth. Yeah.
Okay. All right. So, I understand, doctor, sometimes you will also refer to SoundLIFE for hearing assessment first, right? So, what would be, doctors, your reason why you need to refer to the audiologist for the hearing assessment, because sometimes the patient that especially referred by you, they also ask us, listen, my child is normal hearing. So I think no need to do the hearing test. But I think this one we would like to use this live to actually share with everyone why is hearing test is needed. So Dr.
That's
would
a
you,
yeah, that's an excellent question. Parents ask me very frequently, Dr. Annie, are you sure do my child really need to go for a hearing assessment? He seems, even though he's not responding when we call his name, but when the daddy come back from work, very far away, when daddy move the grill door, he can hear, he will rush to the door. It's like little bit of sound he will hear. So it's really, I still need to do this hearing assessment. The answer is yes. So what I will explain to parents is that, you see, any children with speech delay, we have to do a hearing assessment, because how children learn speech is, number one, the intact hearing apparatus, as well as the hearing mechanism, the hearing pathway. And number two is the environment, and they will imitate and observe how the caretaker speaks to them. That's how they learn speech. So if there is a hearing problem, that will definitely impact or affect their speech development. And this actually, hearing impairment can cause delayed speech. And most children with autism have delayed speech. And studies also have shown that, I think depends on which study you look at, there are up to 3 to 4% of children with autism also have coexisting hearing impairment as well. So for me, this is something that we should not miss, because hearing impairment is something that we have very good treatment for. So I feel that it's a sin that I don't screen them for hearing impairment, because if we miss a hearing impairment, this will further impact on this already delayed speech development. And this is something that we can do something about. So I will tell parents, okay, if the hearing come back normal, so at least we know that this speech delay is to this brain problem, right?
Yeah.
However, if we pick up that there's also a hearing impairment present, so we know that. So on top of autism, this kid also have some hearing impairment, and it's good that we do it early, because hearing impairment is something that we have good treatment for. Which I think Aliyah, you're going to explain further. Of course, for children, the autistic kids that I see, when there's hearing assessment needed, because I see kids from different places, so I have a very few center that I refer to. Depends which one is convenient to them. However, I cannot refer them to any shop lot hearing center, because I have to refer them to the center that is familiar in handling children, pediatric cases, the children. And also they have the test and instruments to do the hearing test for children, which is different from adults. So I think it happened that your center has pediatric setup, and also near to some of the families I see. So, but there are some families which I refer to other centers as well, depending what for them. So maybe Aliyah sort of explain to us what are the tests that you utilize, and how is it done?
Yes, can. All right. So over here, a lot of kids that is referred to SoundLIFE, let's say for hearing assessment. Of course, the first thing that we as an audiologist we wanted to know that is this child having speech delay due to hearing loss or due to others. So in SoundLIFE, we are having comprehensive pediatric hearing assessment. Then one of the over here, I say separate them into objective hearing tests. That objective hearing test means that when we do the test, we don't need the child to give us any response. Okay, there is no behavioral response. Like for example, I pass you give me your hand, then I pass you something. We don't need this kind of response from the child. So everything is actually automatic run by the equipment. So normally what we do is like we require the child to sit still and then be quiet when we take the measurements. So these are the three tests that we will do. The in pulmonary, OAE is called autoacoustic emission, and also auditory brainstem response ABR. So this is a diagnostic test. The other one is subjective hearing test, where we will require the child to give us the response. For example, we have this visual reinforcement audiometry. We also have conditional play audiometry. And the third one is behavioral observation audiometry, which is for younger children. So let me explain more in details. All our hearing tests and the tests that I mentioned earlier, we are having a purpose to diagnose which part of the hearing is having issue. The picture I show here is the anatomy of ear, which comprises of outer ear, then the middle ear, and the inner ear. And then we also have the nerve, and then the nerve will actually wire all the signal to the brain, which is called auditory cortex. Okay, so for the hearing evaluation that we have in SoundLIFE, the first one, every patient that comes in, right, we will firstly to check their ear first, outer ear. So this is the picture how an audiologist use the otoscope to see what is happening inside the children's ear. If the children having some wax or even having some middle ear fusion, then it's recommended maybe we can reschedule the test or refer to the ENT for treatment first. Because if a lot of tests, right, then the result that we obtain may not be accurate. Then the second test we have is called tympanometry. It's actually a test, just like the picture shown. We just need to click the things and then put the probe inside the patient's ear. And then after that, we just need the child to stay still for 1 minute. It's not long, for 1 minute only. So what happens is that some children, they can perform it even during the awake situations, but some children cannot. Especially, I will say that some kids, right, maybe having a little bit this autism sign, they are very hyperactive and they don't like people to touch their ear. So for such children, we have no choice, but we will recommend that we need to do the test during their sleep or during the sedation. Then we also have the OAE. This OAE is called autoacoustic emission. It's actually a test for us to measure the outer hair cell function in the inner ear. Then we also have all these hearing tests, which we call it different name. So VRA called visual reinforcement audiometry. So as this picture seen that you can see over here, we actually run the test, and the instructor in front of the children is actually keep on asking the children to look at the front. But when we play the sound from the speaker, like actually we are training the child to look at that direction, so that by taking this obvious head turning, we are taking it as a response. So for this particular test, we need the children to be awake and also understand what is the test about. So for some children, they can perform, for some children, they can't. Then the level, when the children age a little bit, then we also can perform this conditional play audiometry. So many people may not understand what is actually called play audiometry. Over here, I have one video to show to you all.
Test like for kids. Our son has not been responsive to sound recently, so we wanted to find out if he has hearing loss. We found SoundLIFE on Google and they have a lot of good reviews, so we decided to bring our kid here. After consulting with the audiologist, we were recommended to go with the CPA test, which is a behavioral hearing test where kids get to play with toys and listening games. So here's how they do it. It looks fun. Hearing test sounds very scary for kids, but not here at SoundLIFE. 10 over 10 recommend for you parents out here.
So this is actually one of our TikTok video that we just come out recently. So as you can see earlier, just now I showed we show that what we do, how we do the test is that we let the children to wear the headset, and sometimes if too big, then we wear the insert earphone. And if let's say the child can hear the sound too, then we actually train them to put down the toy. So at the end, right, the child will thought that the toy will produce the sound, and then when they hear, they put down. So this is how the test is run. And again, this particular test, we need the children to be awake. So in SoundLIFE, we have attempted and we can get the reliable response as young as for 2.5 years old kids. Okay. Then the next test that we have is called ABR in short form. Then auditory brainstem response is the longer name. So for this particular test, as you see in the picture, we don't really need the children to actually respond anything. So sometimes the children be more quiet is better for us. So we will put the children into sleep. Then if we can, then after that we will scrub their forehead and also behind the moustache. And then after that we will base the electrode and run the test. Sometimes if let's say the children always move, some children during sleep outside they cannot sleep tight, then we will have a lot of biological noise, then we also cannot proceed the test. So for this particular children, we normally recommend them to be sedated. So just now you can see a picture actually below our center in SoundLIFE, Setia Alam. We partner with one of a pediatrician called Dr. Quick, and Dr. Quick will actually help us to sedate the children. And then after that, the mother will bring the children up, and then we will have a bed to let the children sleep. And this is how we will run the test. So sometimes the whole overall test, I would say, would take about maybe for the test itself, it's actually about 45 minutes to 60 minutes. But the process to put the children into sleep, the process for us to take the parents' case history, doctor, you imagine how long we take? I would say also about your time, 1.5 hours, sometimes 2 hours also lah. Sometimes even 2.5 hours. If like after the test, then the children, the parents got some questions, then we will stay and answer the questions. Okay. So over here is just the introduction to everyone here. From the test that like just now audiometry is actually got it, the name is got it from an equipment called audiometer, where the audiometer will produce different pure tone sound, and we can get it like, for example, this chart from 125 hertz to 8000 hertz. Normally the test for children, we will do it between 250 hertz to 4000 hertz, a different tone. And then from the soft sound to loud sound. So after we obtain the test result, we can draw a line over here, right side with the circle and left side with the cross, and we are able to diagnose what is the level of the persons. If let's say their hearing is actually more than 20 dB, like 21 onwards, then meaning the person will have some hearing loss. Okay. All right. So over here we also have the next one is about. Sorry, I think that is my part for doctor. Yeah, that's my part. So doctor, when you mentioned just now the equipments, right? Over here I would like to share with everyone here. So in SoundLIFE hearing, of course, in order to make the environment more friendly to children, so you can see that our corner reception also we have some toys, and then a comfortable place for the parents to like pujuk the children. Later you need to do this, do that, and then we also have a variety of toys to actually allow us to play. And sometimes if let's say the play audiometry, experienced audiologist, we can handle it one person, but sometimes if the child very have short attention span, then we will need to have 2 audiologists to attend to the children. Yeah. Okay. So doctor, I think we should go into the last part. Okay. What are the intervention of autism?
Okay. I think the spelling autism there. So the intervention for autism is basically multidisciplinary. Okay, and every child is different. So basically, for in short, in summary, I mean, for most of these children, because they have speech delay, so the expert, the professional in this will be the speech therapist. So speech therapist will help with communication problem, which is delay, or a lot of these kids, sometimes these kids, they have language. However, they are not using language in a socially appropriate manner. this is what we call a pragmatic use of language. So again, this is also the expertise of speech language pathologist. And as I mentioned, the main problem in autism is social communication. So communication is one. The main thing is still the social part. So the social part, okay, this kind of intervention can be done by the occupational therapist. So occupational therapist is a professional with a very wide spectrum of expertise. They can help with social skills. They can help with fine motor skills. A lot of children with autistic children also have fine motor delay. So fine motor, the occupation therapist can help. Occupation therapist also can help with what we call emotional regulation. Yeah, a lot of these kids also have problem with emotion regulation. Their emotion can go from 0 to 10 in just 1-2 seconds. Okay, usually our emotion we build up, then we burst, right? But for children with autistic, sometimes they can go straight from 0 to 10 in just 1 second. So they have problem with emotional regulation. OT also can help with self-help skills, like dressing, undressing, themselves, toileting. Yeah. So these are the two main professional, the occupational therapist and the speech therapist. But again, I always tell parents, the main therapist is you. Parents, it's you. I will look at it and say it's you. It's not something you suck on to speech therapist or occupational therapist, you know. You are the main therapist. Parents have to learn. There's a lot of things to learn, no doubt. There's no shortcut, but they have to learn how to teach their children. And very important, they have to socially engage their children during every waking hours. Make sure their children is socially engaged. That is the most important thing. Yeah. So, and a lot of things parents can actually do during their daily routine. Parents have this misconception. Therapy means I must send to some center, I must send to some speech therapist or autist or occupational therapist. There's the most they do is probably 1 hour per session. That's like a lot really. Actually, a lot of family can't even afford that. That is definitely not enough. So I tell parents is the one who spend the most time with the children. So there's a lot of things, daily routine stuff that parents can do to help children in their social communication development. You know, simple things. Sometimes it's actually very simple thing. For example, I tell parents, okay, for example, when you bathe your child, for example, the child still don't know how to name their body parts yet. So when you wash the hair, you can wash the hair and say hair. You touch the ear and say ear. You touch the eyes and say eyes. Just like that, every day when you bathe your child, you do some. Maybe you make it fun. You touch their body parts. You tell the child what it is. You repeat every single day. When you feed your child, you show the child, okay, this is chicken, this is fish, this is egg. This is already teaching moments. Teaching moment is during the child waking hours and in everyday routines. We don't have to just go to a center or go to therapist for teaching.
Yes, correct. Actually, in the audiology, we also mentioned that because we also deal with a lot of kids with hearing loss. And so what happened is that for a kids to learn a word, right, there's a study show that the child need to expose to that particular words minimum 34 times, I think. Minimum 34 times, then they can memorize. And then suddenly one day, because we repeatedly show them about this word with action or make them understand the meaning, then suddenly one word, one day the child can come out. And if let's say, just to let you all to know, generally for audiologists, how we gauge whether the children have normal hearing, the simply words is that, simple questions sometimes we ask is that, does your child respond to calls when without any visual sign, like you call them from behind? Do they respond to you? So of course, sometimes hearing loss kids, because due to they are not able to hear due to having hearing loss, they will not turn to you. But for autism kids also sometimes will be having the similar symptoms. That's why it's important that we want to rule out that autism is due to really the brain disability disorder. So we want to find out which one is the one causing. And nowadays with hearing loss, the treatment can be happen, the intervention can be happen as early as before 6 months old. So as long as we are able to diagnose the child with like hearing loss before 6 months old, and we put them with the hearing aids, right, or even the cochlear implant, the child can have a normal speech and language development just like another normal hearing child. So this is how advanced that hearing aids has become. The technology is already available to help those children with hearing loss. But however, I myself personally also seen that there are some children with hearing loss. In my hand, already got 2 cases that the children is having hearing loss, one side, and the other side is normal. So normally we say that single-sided children, probably they will have a normal hearing, and then they will, for their normal ears is having a normal hearing. So they are still, at least because having one side normal hearing, they still can have this normal speech and language development. But for this particular kids, it's very special. We can see that the movement a bit slow, and sometimes also not paying attention, short attention span, and then also like to scream, and then a bit hyperactive, not easy to control during the clinic, during my assessments. So later that we find out, I feed the children maybe around 2.5 years old until 5 to 6 years old. Actually, is also diagnosed with autism. Yeah. So sometimes the children may have 2 hearing loss, which is autism, together overnight. So
Yes, yes.
yeah,
Yes, as I mentioned, there are studies which has shown that certain percentage of hearing impaired children can have autism, and the other way around as well. Autistic children also can have coexisting hearing impairment at the same time. So this is something that we have to actively screen, and we don't want to miss that.
yeah. So for as an audiologist, I also encourage parents that, because if let's say your children is not speaking, like they don't know how to express themselves. I mean, just now as I see a pediatric cases came to SoundLIFE, and then the children was about I think it's about almost 6 years old, but it's only 1 to 2 words. He can understand instruction. He just don't want to speak. So we also don't know that whether the children is having some other underlying language disorder or whatever, because the children has been fitted with hearing aids, and by right with the hearing aids, they can speak. He can speak. But it's just that the children don't like to speak. So for such children, we really wanted to help the children further. So we will refer to others like Dr. Annie for screening, or even like some other therapists to go through different therapies as well. So yeah, I think we are almost reached the time, Dr. Annie. So let's go through the Q&A. Okay, we have over here. Macam mana nak bezakan kanak-kanak yang autism dan syndrome Down? How to differentiate children with autism and Down syndrome?
Okay. Down syndrome children, they have this physical appearance, especially on the face. That is very, for us who are trained, we can recognize it very easily. We call it the Mongolian slant. Then they have flat nose. So, and then sometimes they may have these features of their hand. They have this single crease on their hand. Not 100%. So there are this constellation of physical features we will look for. But of course, but again, Down syndrome is quite straightforward. We can actually do the blood test, the chromosome study, and which will detect this extra copy of chromosome 21. Clear-cut diagnosis. So when we see these features, we will do the blood test, we can diagnose Down syndrome. But again, things are not so straightforward. We Down syndrome children also can have autism at the same time. Yeah, I mean, I'm not saying all Down syndrome will have autism. Most don't, but it can happen. That's because you have Down syndrome doesn't mean you are immune from autism. It's possible that Down syndrome also can have autism at the same time. So, but the thing is, the Down syndrome children, usually they have what we call global developmental delay. When we do developmental assessment, usually all the domain all will be delayed in a very uniform manner. Whereas children with autism, when we do developmental assessment and we look at their profile, you will see that the social communication domain is the one very markedly delayed compared to the rest. So the delay in autism is not even. It's the social communication part which stand out the most. So there's a difference in the global delay profile for Down syndrome and children with autism. And Down syndrome children, even though they have delay in gross motor, their fine motor, their speech, however, they are very sociable. Their eye contact, the social interaction is intact. That what difference. So this social development, even though they are delayed, but is there. The eye contact is there. The back and forth social interaction is there. So this is something that very different from children with autism. For most
Doctor,
autism,
the same audience also posted this question later on. Adakah kanak-kanak yang speech delay ni boleh terjadi kepada kanak-kanak yang lain seperti Down syndrome? Adakah sama assessment yang dibuat? So yeah, actually is also I also feel interested with this question. So is all the Dr. Jason, you have mentioned that in your diagnosis normally you will screen all the development happen to the children, right? Whether they are following the milestone or whether they are not, they are delayed. So
yes.
do you also do the same set of the screening or even assessment for children with autism, for Down syndrome or any other normal hearing children?
Yes. The developmental assessment is the basic development assessment is similar because we are looking at the milestone. For example, we are assessing this kid. For example, he's 3-year-old, whether or not his gross motor, fine motor, speech, social, and self-help is it tally to his current age or not. He's 3-year-old, but then when we do, then we notice, no, this is his gross motor is is 1 year delay. His speech is 2 year delay. So then we see the discrepancy. So in same with children with actually any children with any developmental concern can be delayed in any of the domain. So we have to do the assessment in all areas because we want to see which one is delayed and delayed by how much, right? And we see the pattern. However, there's no one developmental assessment that can diagnose everything. The developmental assessment is just give us a baseline, an overview of the developmental profile. But again, when I noticed that this child also have suspicions of autism, right? I also observe the child other features that support my diagnosis of autism spectrum disorder. As for the case of autism spectrum disorder, globally, doctors use what we call the DSM-5, the Diagnostic Statistical Manual of Mental Disorder, 5th edition. This lay out the diagnostic criteria to diagnose autism spectrum disorder, and globally over the world, doctors refer to this for diagnosis. So we have to look whether the child I have enough evidence that fulfill all the criteria in DSM-5. If fulfill the criteria, then I will put down the diagnosis of autism spectrum disorder. So this is what we refer to for the diagnosis. So the diagnosis actually is the history plus observation plus developmental assessment plus some other specific instruments depending on the case. Yeah, but for Down syndrome, usually they have global development delay. Yes, they have speech delay as well. However, they do not have the social communication features and also those unusual behavior patterns that is seen in autism. unless this Down syndrome kid very unfortunately also have autism at the same time. But to say we are saying Down syndrome without autism, their social communication is usually impaired.
Yeah. So I think same with the hearing loss children. Usually, how we are trained that autism children may not have eye contact when we communicate with them because due to their lack of social communication skills. But with the hearing loss kids, they are not responding to you. Sometimes it's because they cannot hear. That's why they are not responding. But if you put on the hearing aids on them or you make the sound even louder to a threshold that they are surpass their hearing threshold, they are able to hear, they will look at you and maintain the eye contact. Yeah. So thank you, Doctor, for your sharing today. It's a very long sharing, and then I think we just surpassed about 5 minutes. One of the things I myself very interested to know, Doctor, why? I mean, at what age do you think you can diagnose the children with autism? How young we can diagnose the children with autism?
I think now doctors are getting better and better in diagnosing. So previously, usually a few years back, I think people say maybe 4-year-old, 3-4-year-old. But now, if you are talking about very experienced doctors, now we are talking about 1 year to 1.5 year.
Wow, that is early. So 1 year and 1.5 year also, how you diagnose is also depending on what you mentioned earlier, like the
Yeah,
case history, the observation, the DS, sorry, the
DSM-5, DSM-5.
DSS5. Okay, all right. So yeah, so I think hopefully this sharing can benefit to all. So we recommend, even though our life is almost end, feel free to share our video to more people because we really put effort to come out this talk, and then we hope that at the end we can reach out to more people to spread about autism awareness because of this month. April is also a World Autism Day, happened on second, right, Doctor? Second or third of April.
Yeah, 2nd of April is supposed to be the Autism Awareness Day, but April is supposed to be the Autism Acceptance Month. Yeah.
Autism Acceptance Month. Okay, thank you, Dr. Annie, for your corrections. So, do you like to end this slide? Okay, end the sharing with this by Doctor.
Yeah, I highly recommend this book. It's called Neurotypes by Steve Silverman. So one of the quotes by him is, one way to understand neurodiversity is to remember that just because a PC is not running on Windows doesn't mean that it is broken. Not all the features of atypical human operating systems are bugs. So it changed my thinking about autism, because traditionally, I think we think of autism as pathology. Yeah. So, however, there's this movement now that to think it as a differently as a neurodiversity. It's just that the brain are wired in a different way. They have their own strength. They have their own weakness, just like all of us. So I think we should focus on their strengths. Of course, we need to help them overcome some of the difficulty that might impair their functioning. So anyway, this concept of neurodiversity is quite active now. That is like an active movement now to change the way we think about autism. Yeah. So I think, I don't know if we have time for the next slide. The slide is about the useful resource for. Yeah, I think I highly recommend these two websites for parents. You can snap a photo. The first one is by CDC, is a developmental milestone tracking. They actually have an app you can download for free from your phone. It's called the CDC milestone app. So this one, if you go to the website, they will show you normal developmental milestone, a lot of videos, what is normal developmental milestone that you should observe in your kids at different ages. Very helpful. The second one is the MCHAT revised screening. So if any of you, or you have any friends or relatives that is worried or not, is my child autistic? I'm not sure. Of course, you need to bring them to see your nearest pediatrician. But before you see your pediatrician, you just go to this Autism Speak website. There's this autism check screening, very easy. You just click 20 question only. You click yes, no, 20 question. At the end of it, they will come up whether or not your child is low risk, moderate risk, or high risk for autism. So you print out the result. If it's moderate or high risk, you print out the result, get an appointment to see your nearest pediatrician for assessment.
Okay. Thank you, doctor, for your sharing. So we would like to end this talk with this song. This song is actually specially how I say, is an autism kid also. It's called Jacob Rock, and Jacob is non-verbal. So some of the children with autism, they couldn't speak with verbal. Okay, even though they can hear, they are always observed. They may not able to speak. And however, despite Jacob never learned music before, never have a very proper education, never been to the proper school, this is the music piece that he is able to translate from his mind, his emotion into this. So doctors, let's end this one. Music, before I play the music, do you have any other thing you want to share to our audience today?
Not really.
Not really. Okay, that's all from us. Okay, we will announce the winner in SoundLIFE Facebook page later. So if let's say you wish to know whether you are the winner for this 50 ringgit voucher for hearing assessment, feel free to check out SoundLIFE hearing page. Okay, that's all. Thank you, everyone. Thank you. Bye bye.
Thank you.
I'm very glad you felt that my latest work was worth your time and money. The symphony is my story, so enjoy being in my head for 70 minutes.